Ummah is one. They taking our lives, but they're wrong. Us to the Lord of the worlds we belong. So we gotta wake up and sound the alarm. Oh, my people, get up before we are gone. Cause we ain't gotta fight if we just unite and tell the world to rise up. Rise up. I'm gonna make a difference. Take back what's mine.
Your station, my station, our station, Radio Al Ansar.
Mikhail, what on earth is that in between your toes?
I have no idea what it is, but it's really itching and I've had it for quite a while.
I know what it is. If you don't wipe in between your toes to keep it dry, you can get a fungal infection. That's what it looks like.
Really? How could you possibly know that, Salma?
I heard it on Medical File on Radio Al Ansar.
Yes, listen to Medical File on Radio Al Ansar. Become empowered to care for your body in the best possible way.
WhatsApp us now on 060 904 1056.
Medical Files, and we welcome you to Medical Files this morning with myself, Faizal Suleman. Assalamu alaikum wa rahmatullahi wa barakatuh. Our very special guest this morning again needs no introduction to the airwaves of any radio station, leave alone Radio Al Ansar. We say Assalamu alaikum wa rahmatullahi wa barakatuh to Dr. Farouk Hafejee.
Wa alaikum salam wa rahmatullahi wa barakatuh, Faizal, and to your listeners.
Dr. Hafejee, Jazakallah khair for joining me on the program. Our topic for discussion: management of chronic conditions during Ramadan. And, many of us are on chronic medication. And this is one of our biggest challenges in the month of Ramadan. How do we maintain, how do we control, how do we balance, yet, keep our fast as well? So when we use chronic medication, Dr. Hafejee, what do we mean?
Yeah, that's a good question, Faisal. And this term was derived by medical aids, actually. It's medication that you normally take for the rest of your life. So it's medications that people with diabetes, high blood pressure, asthma, anything that needs control, autoimmune diseases, they all need medications to be taken throughout your life. And glaucoma, eye drops, that's another one. All these are medications that people need to take throughout their lives, and that's chronic medication. The others are all regarded as acute medications, and these are medications like flu. And sometimes antidepressants are also not, you don't take them for the rest of your life, so they are not regarded as chronic medications. They're regarded as acute medications, and sometimes people confuse them. Anything that you take which may last for a year or 6 months or whatever, anything that you stop taking is regarded as acute medication.
Mm-hmm. So our concentration this morning is on chronic, but of course I'm sure we'll touch on acute because I'm sure that also affects the health. Doctor, some medications are taken 3 times a day. Now, how can this be done without interfering with the fast?
Yes, nowadays most conditions are now controlled by once-a-day dosage or twice-a-day dosage. But there are some that require 3 times a day. And what you do is you just turn the day into night. So what you do is but you must remember, because you have a shorter period at night, you need to be very disciplined. Mm-hmm. So the first dose you take is when you break your fast, not at iftar or after iftar. You take it when you break your fast. And then the other dose, the morning dose, you take when the last sip of water you're taking in the morning, that's when you take your medication. And the other one you take at about 10 o'clock at night. And that will be your 3 times a day. You've now transferred it to 3 times at night. And that should work quite well.
This is an interactive program. If you have any questions on chronic medications and on fasting during the month of Ramadan, then you may forward them to us on 060 904 1056. That's via WhatsApp. 060 904 1056. Dr. Farouk Hafejee will attempt to answer your questions. But please restrict your questions to chronic medications and other conditions that will affect your fast during the month of Ramadan. Now, Dr. Hafejee, let's touch on high blood pressure. Are there any changes that need to be made, during Ramadan so far as high blood pressure is concerned?
That 30% of people are general people, random people. they don't know that they have high blood pressure. That's such a silent disease. And 30% of people with high blood pressure have high blood pressure which is not well controlled. That's very important now, that we need to make sure that our blood pressure is well controlled. That's one of the most important things to do. And that we normally do before Ramadan starts. But even now too, you should take your blood pressure in the morning and in the afternoon, in the evening. And in fact, it's a good idea to take it at when you get up in the morning, because sometimes some people have normal blood pressure during the day, but their blood pressure will spike in the middle of the night, and that's not a very good form of high blood pressure. The one that spikes at night. It should dip at night, not spike. But if it spikes, there's a problem. So just be careful about that. Now, with most high blood pressure medications are once a day or twice a day. So that is very convenient for us. But one of the things that we need to think about is that a lot of the medications contain a diuretic, a water tablet, which makes you pass extra water. So now you don't want to take this in the morning because you're going to be passing extra water during the day. So you need to take this at night. So you need to switch over. Instead of taking it in the morning, take it at night. The one with the water tablet. Now, how you know that is that you look at the ingredients in the container, and it'll show you that there is a water tablet in it, or the name itself will tell you. There may be a plus next to the name, or a co, or a comp, or some other this little thing that will indicate to you that it's not only the original drug, but there's another drug added to it, which is the water tablet part, and that one should be taken at iftar, not in the morning.
Mm-hmm. Now, talking of blood pressure, if one wants to take one's blood pressure, one just gets a blood pressure machine from one of the pharmacies or something to that effect. Is that correct?
Blood pressure machines are not very expensive. They're about 300 rands or 400 rands each, good ones. And yes, people, I think everyone with blood pressure should have a blood pressure machine, because the best way to test your blood pressure is by yourself at home, because we have a condition called white coat hypertension, white coat high blood pressure, which means that when a person goes to the doctor or to a clinic, because they are anxious, the blood pressure rises, and so you are getting not a normal blood pressure. You're getting an exaggerated blood pressure. So it's not your normal blood pressure. Mm-hmm. If you take it at home, you are most likely going to be getting a normal blood pressure, unless you've had a problem with one of the family members, in which case then we have raised a blood. But you need to be sitting down, mm-hmm. calm, and you need to take your blood pressure. When you take your blood pressure, don't talk, because when you talk, your pressure rises. It's amazing, because so you need to be calm, quiet. Nobody must talk to you, and you must take allow the machine to take your blood pressure. Don't take the first one. Do the second one, because sometimes the first one, the machine is just adjusting itself. Take the second one or the third one, and that will be a more accurate reading.
Thank you for that, Dr. Farouk Hafejee. 060-904-1056. We are discussing the management of chronic conditions during Ramadan. Now, Dr. Hafejee, people with asthma may have a problem during Ramadan. They may need to use an inhaler. Can an asthma inhaler be used during fasting?
No, it cannot be used. All the ulama agree that it cannot be used. It's like smoking. That's why smoking is not allowed. And you're getting with the inhaler with the spray that comes out, there's droplets of liquid in it, and that's not allowed. That's why it will break your fast if you're fasting and you take an inhaler. Same goes with the nebulizer. You cannot nebulize while you're fasting. So with these restrictions, you can see how important it is for people with asthma to have the asthma under control, well under control, so that they don't have to use the acute medications like an inhaler or nebulize. And these medications are available. In fact, all asthmatics should be on preventative medication. These preventative medications are taken once a day or twice a day, and that can conveniently be taken now while fasting, in the morning and in the evening. These are inhalers, the powder inhalers, the other inhalers, twice a day, and it controls your asthma very well. And in fact, all asthmatics should be on it. And so there may not be a need to take any inhaler or nebulize. But in the event that you've got such bad asthma, you should talk to your doctor and maybe for a month go on to a medication that will control your asthma with a tablet rather than using inhalers as well, but with a tablet as well, just for the month of Ramadan to keep it under control.
Now, if you have to take this during Seri time, Dr. Hafejee, is it going to have any side effects during the day that will affect your fast?
No, it won't.
It won't.
Mm.
Okay. And how can a person with asthma control the asthma so they can fast?
Yes, that's the preventative medication that we talk about. And there are some very good medications that are available. They're expensive, some of them, but they control asthma very well. Why not use them? With asthma, it can be quite distressing not to be able to breathe. So it's something that's important for us to do.
Okay, there's a question that come through. Salam's doc, great topic, thank you. I've been asked to take my blood pressure machine to my doctor for it to be calibrated. What does this mean?
Yes, like all machines, they need to be. You need to make sure that your blood pressure machine is reading the pressure correctly. So what they will do is they will take your machine, they will take your blood pressure on your machine, and they will take a blood pressure at the same time on their machine, which has been calibrated. So that means we know that their machine is accurate. Therefore, they will then compare the two figures to make sure that the figures that we are getting on both machines is about the same. And that's how you know. If it's not the same, it needs to be serviced and corrected so that you get a more accurate blood pressure reading.
Jazakallah khair for that, Dr. Hafejee. 060-904-1056. Any questions for Dr. Hafejee on management of chronic conditions during Ramadan? This is your opportunity. Now, Dr. Hafejee, most medications for epilepsy are taken once or twice a day. That should be okay for fasting. And is there any advice that you can give to people who have epilepsy?
Yes, epilepsy, you can get breakthrough seizures. And you must remember that, because that can happen, and the precipitating thing that can create seizures in well-controlled people with epilepsy are things like stress and lack of sleep and hunger. These are things, and things that may upset you in some way. So in Ramadan, of course, we're hungry, and of course that can put a stress on the body, and that can precipitate seizures. So they need to be very calm during the month of Ramadan, and not do very much physical work. They should calm down and take this month very easy. I mean, it's ideal actually for them to do that, because now they can read more Quran, they can make more zikrullah, and keep away from people who may annoy them for that month until the month is over.
And reciting the Quran too has its physiological benefits as well. Yes, alhamdulillah. Now, Doc, can people with low immunity caused by some disease fast?
Yes, there are, people with low immunity usually caused by drugs themselves. These are drugs that are called disease-modifying drugs. So they are usually used in autoimmune diseases like ulcerative colitis. They are used for things that may require long-term treatment for autoimmune diseases. Now, these are drugs like methotrexate and the plasmaquine, and there's a whole lot of rheumatoid arthritis is one of them that needs to be controlled. That needs to be controlled in this way, disease-modifying drugs, and these drugs usually decrease immunity. They bring down the immunity, and because they bring down the immunity, there is a risk of them getting infections. So they need to, the people who are on these drugs, these disease-modifying drugs, should make sure that, and also people with chemotherapy, people on chemotherapy, people who are receiving radiation treatment, all these will bring the immune system down. So you need to protect yourself by not mixing with people in a crowded room with poor ventilation, because you may pick up infections there. And if you pick up an infection, it's not going to take you 4 or 5 days to get over it. It's going to take you 2 or 3 weeks to get over it. So why put yourself into that problem? You can fast if your disease is under control quite well, and if you had okay from your physician that you can fast, but you need to again change the way you're living, your lifestyle. You need to be quiet. You need to spend a lot of time on your own, or in a secure environment like a home, and it's only for a month. After a month, you can go back and do what you want to do. But during that time, you need to be sure that, in fact, I'm just thinking now, even normally without fasting, you shouldn't really be in a crowded room with poor ventilation, because taking these medications will have an impact on your immune system, and it'll create a problem for you.
Jazakallah khair. Doc, we'll take a quick ad break. We'll continue on the other side of this, inshallah.
Getting you through your day. Radio Al Ansar.
Oh, happy day.
Eid Milan 2025 just got bigger. We're bringing you top brands and exclusive deals for the ultimate Eid shopping experience. From fashion to home decor, gifts and gourmet delights. Everything you need is under one roof at Saxony Westwood Mall, 20th to the 23rd of March. Don't miss out on shopping with the biggest names in the industry. See you there.
A day for friends and family.
Salam everyone, I'm Fems, and here's the easiest treat to enjoy for iftar. Whether you call them bhajjas, dalchis or pakoras, just one pack of Paco chili bite mix, a splash of vinegar, and enough water to make a batter. Make it thick or thin. Add potatoes, sliced onions, coriander or spinach. Anything goes. Paco chili bite mix is a family favorite for over 75 years. The perfect chili bites. Crispy outside, soft inside, every time. Paco, just the right bite.
WhatsApp us now on 060 904 1056. The views and opinions expressed by the guest and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Radio Al Ansar presents a special outdoor broadcast. Join us live this Saturday, the 15th of March from 10 a.m. to 11 for an exciting event dedicated to the Al Baraka Umrah competition. Want to stand a chance to win an unforgettable Umrah trip? It's simple. Download the Al Baraka SA mobile banking app. Complete just one transaction. Already a client? Just transact and you're in. Come down to the Al Baraka Kingsmead office, open a transactional banking account, download the app and start transacting. And who knows? You could be on your way to the Haramain. Plus, we have exciting surprises for all those who join us. Mark your calendar and spread the word. See you there. Radio Al Ansar, your voice, your community.
Looking for a pharmacy that knows you're more than just a number? Pharmaclin Sydenham Pharmacy, part of the Pharmaclin Group of Pharmacies, has branches across Durban, open daily from 8 a.m. to 10 p.m. for your convenience. Located at 418 Randalls Road, Sydenham, Overport, next to Sparks Road, or simply enjoy free delivery straight to your door. Visit us for unmatched healthcare today.
We'd love to meet you. Pay us a visit. Radio Al Ansar.
Mikhail, what on earth is that in between your toes?
I have no idea what it is, but it's really itching and I've had it for quite a while.
I know what it is. If you don't wipe in between your toes to keep it dry, you can get a fungal infection. That's what it looks like.
Really? How could you possibly know that, Salma?
I heard it on Medical File on Radio Al Ansar.
Yes, listen to Medical File on Radio Al Ansar. Become empowered to care for your body in the best possible way.
You are listening to Medical Files with myself, Faizal Suleman, and our special guest, Dr. Farouk Hafejee. We are discussing management of chronic conditions during Ramadan. Dr. Hafejee, we have two questions come through. The first says, Assalamu alaikum. My husband is 84 years old. His blood pressure is always between 90 and 110 over 70 or 80. He's on Ciplavask, 10 milligrams once daily. He's been advised to take his pressure tablet every second day, but sometimes it goes below 100 over 70. What advice can you share?
You see, in a person who is 84 years old, you see, as we get older, our arteries get a bit harder. Normally, in a younger person, the arteries have muscles, and they contract and they relax according to how the body wants it. So if sometimes when you get angry, your arteries will contract, raising your blood pressures, because you need more blood in your brain and you need more blood in your muscles to run away from things or to do things. But as you get older, the arteries get harder. They don't respond as much. So in a person who is 84 years old, they probably got hard arteries, which will create a problem. So there's not much fluctuation in the blood pressure. Now at that level, 90/70, 90/60, that's too low for a person who is 84 years old. And taking a 10 milligram Ciplavax is a bit, and taking it alternate. This is something is not right here. The first thing is that you should stop the blood pressure tablets talk to your doctor about it. And I think it's important to have your doctor as a partner in this thing here. But from what I can see, that you may not need it. You may not need the blood pressure tablet, and taking it alternate days is not a good idea, because these medications last 24 hours. So that means you on and off. One day you on, one day you off. One day you on, one day. It's not proper blood pressure control. So talk to your doctor about it. See what happens if you take the tablet away, and just monitor the blood pressure to see what actually happens for about a week after you stop the blood pressure tablet, and see whether it rises. Now, the figure that you're looking for is 140 on the top and 90 at the bottom. So it mustn't go above 140 systolic, that's when the heart pumps, and it mustn't go above 90, which is a diastolic, that's the pressure in the system. So you can allow it to go right up to 140, 90, it's quite okay. In an 84-year-old, that's quite acceptable. Better to be somewhere around 130/80. That would be a good figure for a person who's 84 years old. And I think that but again, I must stress that you need to have somebody monitor it, some medical person monitoring it.
Jazakallah khair, Dr. Hafejee. A question comes to Salam, Stock and Faisal. I am on chronic medication, but I am managing these well during my fasting. My concern is taking my supplements. Is it fine to continue my daily routine of DS24 veggie caps and BKLGM at Seri? Jazakallah.
Problem with supplements is that some of them may make you hungry. And so, you can take them, but don't take them at Seri, at Suhoor time. Take it at Iftar time. Just change it over, because some of these medications have the properties of increasing your appetite, which you don't want to happen. But no problem. You can do that and just change over. And after Ramadan, you can move back again, take it in the morning again.
Okay. On the question of the blood pressure that came through for the 84-year-old, the sister says that he did stop it once, but pressure went very high a few times.
Yeah, maybe they need to reduce it from 10 milligrams to 5 milligrams, because you do get, it's a lower dose. That may be what's needed. But I think they need to go and see a specialist to see why this is happening, because it's not supposed to be happening like that. Then you need to also look at his salt intake, because high blood pressure is very sensitive to salt intake. If you increase the salt, your blood pressure will go up. If you drop the salt, the blood pressure will come down. So again, he needs to have a diet which is low in salt levels to make sure that that's not impacting on his blood pressure.
Let's go to a very famous question when it comes to management and chronic conditions. That's diabetes. Look, people with diabetes previously were not allowed to fast, but because of fear of blood glucose levels going too high or too low. But I think with the technology and recent studies, that has been amended. Now, many people with diabetes are now fasting, alhamdulillah. Are there people with diabetes who should not be fasting?
Yes, there are. In fact, there are people who type 1 diabetics, people who have type 1 diabetes. Type 1 diabetes is diabetes that the body is not producing any insulin whatsoever. So they are insulin dependent diabetics. And there the blood sugar levels can fluctuate very high. It can go up and can go down in a very quick time. But there are people who have type 1 diabetes who manage their diabetes very well, and they can control it very well. They understand the disease. They understand the manipulation of dosages of their insulin, and these people are fasting. In fact, I know quite a few type 1 diabetics who are fasting, and they do very well during Ramadan. But that's one of the exclusions, and that's type 1 diabetes. The other one is with a person with diabetes with kidney disease. No, they shouldn't be fasting, or people with diabetes with heart disease. They should also not be fasting. In fact, early this month, there was a person who had poor kidney function, and he was diabetic, and he was insisting on fasting, and he fasted, and his EGFR dropped right down to 8, 9, which means a dangerous situation. They had to admit him into hospital, ICU, do dialysis, short-term dialysis. And you don't need that. You don't need to do all that. Just talk to your doctor who understands your condition, and they will advise you. But people with a compromised renal function, kidney function, should just watch out that they don't make their life difficult. Not only their life, but the life of people around them, their family members, will also be affected, because they need to take them to hospital and visit them in hospital and create a problem for themselves. So heart disease, kidney problems, chronic kidney problems, yes. And also there is a category of type 2. Type 2 diabetics produce insulin, but not enough. Or they may produce an insulin that is not used by the body very much. It's just, I'm just making it simple for people to understand. It's called insulin resistance, and they may have a problem of controlling the diabetes. So those people who don't control their diabetes very well before Ramadan, and they have high blood sugar levels, 10, 12, 14, 16 sometimes, and sometimes they drop very low. These people, their diabetes is not very well controlled before Ramadan. Now you want to fast, you're going to create a problem for yourself. So unless you get your blood sugar controlled very well before Ramadan, now you can fast without any problems with manipulation of your medications.
And talk about manipulation of your medications. Are there any changes that people with diabetes need to make during Ramadan if they are fasting?
Yes, they are, and we need to. There is a website called DAR Alliance, DAR, for diabetes and Ramadan. That's what it stands for. DAR Alliance, ALLIANCE .co.za. And I think every person with diabetes should go and visit this website. It is a website that's very commonly used in the Middle East. And also in other parts of the world, in South Africa as well. DAR Alliance, DAR Alliance. And that one will give you a very good meal plan also for diabetes. And that's what we need to start with people with diabetes. Besides talking about medication, I think it's very important to talk about the diet, because the diet changes in Ramadan, and it can create a big fluctuations in blood sugar levels. We're worried about low blood sugar levels during the day and high blood sugar levels during the night. Consuming a lot of sugary stuff at night, which will put the blood sugar levels very high at night. And of course, without manipulation of the medication, they can have very low blood sugar levels during the day, which is dangerous for their organs, especially the heart and the brain. So these two factors need to be taken into account. So, you need to. It's very important for people with diabetes not to have sugar. Really, it's not good for them. And let your body make its own glucose, and that's the best way to do it. And if you have sugary things like dates, for instance, limit yourself to 2. No more than 2, and try and pick dates that are low in glycemic index, dates that are not very sweet. Sweet dates have got a lot of sugar in them. The ones that are not so sweet and they are more fibery, the more fiber it has, the better it is for a person with diabetes, because the fiber absorbs some of the sugar and releases it slower in the body. So that's that's a dietary, and you don't have to have a big meal when you're breaking your fast. Just have dates and water, 2 dates and water. That's all. That's it. And try not to have desserts. Desserts are troublesome because they all contain a lot of sugar in them. And you can have some sugar, no problem, as long as you have it after a meal. And you need to, people who prepare these meals, I think I said that last week, people who prepare meals with a person who has diabetes in the family, people who prepare the meal should look at ways in which they can reduce sugar in all the foodstuffs that they are making. So, if they're making a cake or they're making dessert or something, just lower the amount of sugar that you're putting into that for everybody, because that'll be good for everyone, and not only for people with diabetes. So let's start off with a good dietary change. Have extra fiber, because fiber is very good for people with diabetes. Fiber is good for everybody, but for diabetes especially, because the fiber absorbs the sugar and releases it slowly. So that's what we want, and that's what they should be having for suhoor, a fiber-rich cereal, and yes, and also go and have some salad, some vegetable salad, which will also help to give you the electrolytes that you need for the day. So that's as far as the diet is concerned. The other important thing is that people with diabetes should restrict their physical activity during the day, because again, the more physical you are, the more blood glucose you are going to use, and the more blood glucose you use, the lower the blood sugar levels will go. So try and restrict your physical activity to the bare minimum during this month of Ramadan. Fasting is so important. So you need to just make these changes for one. Now, if you're going to the gym, stop going to the gym. You're going for long walks, don't go for long walks for this month. After Ramadan, you can always start again and do it again after that. Now, let's take the medications that we need to see. The most commonly used medication in diabetes worldwide is metformin. Another name for it is glucophage. And it comes in two varieties. It comes in a short-acting, and it comes in a long-acting. Now, the short-acting ones, they work very quickly, so you need to be careful with that. Both of them, long-acting and short-acting, are shown by many studies that they do not drop blood glucose levels very low. So there doesn't need to be much changes as far as taking these two medications are concerned. These metformin or glucophage, which is a trade name. So if you're taking once a day, just change over to iftar. Take it at iftar. And if you're taking it twice a day, leave it at twice a day, morning and evening. And if you're taking it 3 times a day, I'm talking about the short-acting one. If you're taking it 3 times a day, take the morning one, and take the evening one, double up with the afternoon and the evening one for the iftar one. So you're taking 2 tablets at iftar, you're taking one at suhoor. So that's your 3 tablets for the day. Now, if the long-acting ones, the XR, the glucophage XR, these are the long-acting ones. Now, because they are long-acting, that means they will be working for many, many, many hours through the day. Now, you shouldn't be taking this at suhoor time, because your blood pressure, your blood sugar is going to drop slowly. Rather take them at iftar, and you should be okay. So switch over, take it at iftar. Normally we take them in the morning, but now you need to take them at iftar. That's a long-acting metformin or glucophage. Then there is another group of drugs that is very commonly used in our clinics, in our hospitals, which is glibenclamide. These are sulfonylureas. They push the pancreas into secreting insulin, and now they are not sugar dependent, which means that in our body we have a system like a thermostat for temperature. We have a similar thing for glucose. If the glucose goes high, the pancreas produces more insulin. If the glucose in the blood goes low, the pancreas produces less insulin because it doesn't need it. So here, of course, you're getting a medication that's producing insulin despite what the blood sugar level is. So that creates a problem, because now even if your blood sugar is low, it is still pushing the pancreas to produce more insulin. So these medications are not good to take in the morning, because they will cause, and they are noted to cause hypoglycemia. And a treatment adjustment needs to be made here. And usually, if you're taking it once a day, take it at iftar time, because you do need it, because you're going to be eating food, and of course, no doubt, you're going to be having some sugar there too. So you can't take it at night. And if your sugar drops a bit, you can eat. You can always eat and drink the stuff. But hypoglycemia is a problem that we worry about. And how do you make out that you got hypoglycemia? The first symptom that you will get is you start trembling, you start sweating, you start feeling uneasy, restless, you get palpitations, and of course you start getting confused, you don't know where you are, and of course you can get a headache. These are all symptoms of hypoglycemia, and everyone with diabetes need to know what the symptoms of hypoglycemia are. They are a category of people who have hypoglycemia without getting symptoms. These are dangerous people, and that's why, because they're getting low blood sugar without getting symptoms, and that can create a real problem. So that's why we say that you need to test your blood sugar during the day, in case you are one of those that is not responding to the hypoglycemia in a normal way. So we'll come to when you take your blood sugar levels a little later. But you can we are talking about hypoglycemia. Hyperglycemia, which normally occurs at night in Ramadan because of the dietary thing, the food, extra sugar that we're taking, there you'll be passing a lot of urine and you'll be very thirsty. You'll be passing urine. It also has an effect on your vision. You may get blurred vision as well. And you'll start getting tired, very tired, exhausted, because you're losing, with the urine, you're losing electrolytes as well. That's going to make you feel weak. And of course, you can get confused again. Because sometimes with the confusion, there's a problem whether is it high blood sugar, is it low blood sugar? So you need to test the blood sugar at that time to see whether it's high or low, where you are. So that's another category of drugs that's the sulfonyl ureas. And you need to be careful. There's a second generation of sulfonyl ureas, which are dimicron and that kind of. Those are second generation. They are a bit safer to take, but again, you need to worry about the morning dose. If you're taking it twice a day, I would suggest you take it at night and maybe cut the morning dose by half. Again, monitoring your blood sugar levels. Again, you need to contact your doctor and work hand in hand with your doctor and give him the figures as the days go and work out what dosage that you need to make. But lifestyle changes most important in Ramadan, and so that you don't create a problem for yourself by taking high sugar content. Now, we're talking about when to take your blood sugar levels during the day. Now, ideally, with people who are brittle, but sugar levels go up and down, and you don't know, there are 7 times a day that you need to take your blood sugar levels, and not all the time, but just for a few days to know where you are. The ideal it would be for you to have a continuous glucose monitoring machine on you. It's a device that tells you what your blood sugar level is all the time throughout the day, and it has a recording, so you can see exactly what's happening with your blood sugar level throughout the day. But I mean, this is an expensive thing, and you don't really need it if you just do your blood sugar levels many times. Just one thing to point out, and that is that if you prick yourself and blood comes out, you don't break your fast. You break your wudu, but not your fast. So that's important. So the first time you take it is in the morning when you get up. That'll give you your fasting level. The second one you take at about 9 o'clock to see what it is mid-morning. The third one you take at 12 o'clock or 1 o'clock, about Zohar time. And the third one you take in mid-afternoon, about 3-4 o'clock in the afternoon. Another one you take just before you break your fast. And another one you take 2 hours after you break your fast, after iftar. And those are the times that will tell you what your sugar level is doing. Now that's for people who have a real problem with the blood sugar fluctuations. But people who are well controlled can minimize that by taking one blood sugar reading in the morning at suhoor time, another one at about maybe 11, 12 o'clock, another one at about 4, 5 o'clock, and another one at bedtime. And this will give you a good idea of what you're doing. Now, you don't have to do this throughout the month. You just have to do it for about 4 or 5 days to see where you are. As long as you maintain what you're eating every day, you maintain the same type of diet throughout the month, and you don't and the same amount of physical activity that you do, keep it about the same every day, and so your blood sugar won't change. After 4 or 5 days, you'll know exactly where you are, and you can adjust your medications according to how your blood sugar is responding.
Jazakallah khair. Doctor, we'll have to take the next ad break. We'll continue after this, inshallah.
أحب الوفي الأمين الأغر فأهل الوفاء كلون السحاب.
This Ramadan, join Africa Muslims Agency to provide meals of mercy in 23 nations across the world. Feed the fasting for 120 Rand per day, provide a grocery hamper for 1,800 Rand per month, and feed a community for 19,000 Rand per day. A single meal can turn hunger into hope from Gaza to South Africa to Malawi and beyond. Help AMA to set a table where there was none. 23 nations, one table, every meal a mercy.
Radio Al Ansar presents a special outdoor broadcast. Join us live this Saturday, the 15th of March from 10 a.m. to 11 for an exciting event dedicated to the Al Baraka Umrah competition. Want to stand a chance to win an unforgettable Umrah trip? It's simple. Download the Al Baraka SA mobile banking app. Complete just one transaction. Already a client? Just transact and you're in. Come down to the Al Baraka Kingsmead office, open a transactional banking account, download the app and start transacting. And who knows? You could be on your way to the Haramain. Plus, we have exciting surprises for all those who join us. Mark your calendar and spread the word. See you there. Radio Al Ansar, your voice, your community.
Assalamu alaikum wa rahmatullahi wa barakatuh. Halim will be distributed every Saturday at 1 p.m. at the Al Ansar Foundation and also at the Sparks Road Masjid. And on Sundays, Halim will be distributed at Capital Air 176 Brickfield Road, brought to you courtesy of the Capital Group of Companies.
Durban's #1 truck stop, Reef Trade, situated at number 9 Joyner Road, Prospecton, offering a 24-hour parking facility on site with diesel wholesale and mobile distribution for vehicles, generators, plant and machinery to your door, safe parking, truck wash, container handling, restroom facilities, and more. Call us on 083 449 1563 or 083 978 6410 for a free quotation. Reef Trade, we're here for you.
Radio Al Ansar, Durban, 90.4 FM. Peter Maritzburg, 105.6 FM.
You listen to Medical Files, and Medical Files is brought to you by the Islamic Medical Association of South Africa. Our special guest this morning is Dr. Farouk Hafejee, and we are discussing the management of chronic conditions during Ramadan. Now, Dr. Hafejee, just prior to the ad break, you were discussing diabetes, and you did mention the different times when one should take one's glucose levels. Continue with that discussion.
Yes, there are other medications as well, like the GLP-1 and DPP-4 and quite a few others, SGL2. These are all medications that also are used for diabetes, and I think you just need to contact your doctor and work out what's to be done. Most of these don't cause hypoglycemia. There's another category of medications which are insulins. Now that's a bit complicated, so I would suggest that you need a dosage change there, and you need to talk to your doctor there and try and adjust your insulin levels according to your need. Also remember that you shouldn't allow your blood sugar to drop less than 3.9, 4. Let's say it's 4. You cannot allow it to drop less than 4, because then you are now in a hypoglycemic category, and that starts creating problems for your brain and your heart and all your organs. So you need to break your fast, whatever time it is. You need to break your fast because it's urgent for you to do though. If you want to, you can take your blood sugar level and say it is something like 4. You wait for about 15-20 minutes, take your blood sugar again take another reading, and if you find that it's a bit lower, now you have to break your fast, because it means that your blood sugar level is going down. On the high side, hyperglycemia, you shouldn't allow it to go more than 16.7. 16.7, or you can say 17. Don't allow it to go more than 17. Once it goes more than 17, you have to break your fast. Now you are falling into another category where you are going to get toxicity from the glucose, and it comes with a whole range of changes in your electrolytes, your dehydration, everything is affected. So you have to break your fast.
Doctor, the question, I am a diabetic. Recently, I've been feeling nauseous at Sehri time. What could be causing this?
You need to take your blood sugar level at that time, because hyperglycemia, too high blood sugar levels, will cause nausea, and it can cause abdominal pain and vomiting as well. So you check your blood sugar level at that time and see where you are, because you probably find that your blood sugar level has been high throughout the night, and now you're getting these symptoms in the morning. So you need a medication adjustment.
Doc,
there may be another reason for it, but go for that one first.
Now, people with arthritis need to use anti-inflammatory medications. These are known to cause gastric problems and can lead to gastric bleeding. Should anti-inflammatory medication be used during fasting? And there's also a question that's come from a listener as well. Salams, Doc, I forgot to ask about anti-inflammatory tablets. Is it advisable to take it at Sehri or at Iftar? I'm not sure if you can just...
Yes, anti-inflammatory tablets, they besides the local effect on the stomach, which is not as great as aspirin is, they work on the prostaglandin. It's a substance. It's a hormone that in the stomach produces mucus, and the mucus protects the stomach. Now, if you take anti-inflammatories, it reduces that, with the result that you're getting reduced protection in your stomach, with the result that your own acid, hydrochloric acid, pool acid, that's what's in your stomach, and so that will stop. There's hardly any mucus there now because of the anti-inflammatory, and that's what creates the gastritis. So what you need to do, you need to do two things. One is don't take it at iftar at Sehri time, because through the day your acid in your stomach is not being diluted by drinking water and eating food, because you're hungry all the time. You're not taking any liquids or any food. But at iftar you can take it, because you're going to be eating through the evening, and you're going to be drinking, so there will be some dilution of the acid in your stomach. So take it at iftar time. But better still, during Ramadan, I would suggest that you take the anti-inflammatory in combination with a proton pump inhibitor, which is called a PPI, and that reduces your acid level by about 70%. And now, so now you're getting low acid levels in your stomach, and of course, the removal of the protection in the stomach by the anti-inflammatory is not affected that much, because your acid levels are not very high. So when you're taking the anti-inflammatory, take a PPI with it. You can talk to your doctor about it, and take the two combinations, and it should be okay. You should be able to do it without any problems.
Now, Doc, I know you did touch on aspirin blood thinners, but we've got like 1 minute, and many people are on aspirin to thin their blood. And as you mentioned, aspirin can cause problems in the stomach. What is the recommendation for aspirin use for long-term purpose?
Well, you see, we have diseases that require the aspirin. People who have had strokes, people who have had a bypass, people who have had stents put in. These are people who require the aspirin. But if you don't have any of these things, and you're taking the aspirin just for prevention, you should stop taking it, because studies have shown that it is more harmful to take the aspirin, causing other problems in your body, rather than preventing the things that you have. Many people take it because they say, I don't want to get a stroke and I don't want to get a heart attack, so I'm going to take aspirin every day. But they haven't had a heart attack, they haven't had a stroke, they haven't had bypass surgery, and they haven't had a stent. It's not advisable for you to take it. Now, if you do take aspirin, take it at iftar time, because it'll get diluted with your... aspirin has a local effect as well. That's more prominent. So take it after iftar.
I've got like 30 seconds to round up. There's another question that came in which I think is important. Salams, I'm 66, had one kidney removed in July last year, fasted for 5 days, had pain in the kidney, working side. I stopped fasting, pain has gone. What's your advice? Also got a heart condition. We've got like 30 seconds, doc.
No, I think it's a bit of a complicated case, and I think you need to go and see your doctor and work out what's going on. Normally, with one kidney, it shouldn't be a problem. You should be able to fast with one kidney, no problem.
Dr. Farouk Hafejee, Jazakallah khair for joining me in the program this morning. And may Allah SWT accept all your efforts and reward you abundantly.